Thank you, Meijun. Now, I will start off by explaining what is rheumatoid arthritis. Well, rheumatoid arthritis, or RA for short, is a type of autoimmune disorder which causes chronic inflammatory pain in your joints. As an autoimmune disorder, rheumatoid arthritis occurs when your own body's immune system is mistaken and attacks the tissue around the joints, which could lead from experiencing joint pain to severe physical deformities. Moving on, before I give further explanations about the mechanisms of RA, I'll first give a very brief history of RA and how it was discovered. One of the most important publications on arthritis was by William Musgrave called the Arthritis Synoptica in 1715. It is the earliest known text describing in detail the symptoms of RA. However, interestingly, the name itself, rheumatoid arthritis, was given in 1859 by British rheumatologist Dr. Alfred Baringeren. Now, moving on, how does one develop RA? Well, currently, there is no clear cause that causes rheumatoid arthritis, but there are risk factors that significantly increases the chance of RA. These risk factors include family history, the environment, and smoking. So, RA is also a genetic disorder that can be passed down from generation to generation. In terms of environment, RA can also be triggered by chemicals released from the environment like silica or asbestos. Silica increases the risk of seropositive RA, while asbestos increases the risk of both seropositive and seronegative RA. Moving on to smoking, smoking in general actually increases the risk of all types of diseases and disorders. In the case of RA, however, smoking greatly increases the risk of RA and also greatly increases the risk of severity of RA symptoms, like experiencing remissions, and reduces the effectiveness of medication for RA. Now, there are actually different types of rheumatoid arthritis. Currently, there's two types of RA, seropositive RA and seronegative RA. Seropositive RA happens when your blood is tested for a protein called rheumatoid factor. If the test is positive and there is traces of RF in your bloodstream, this indicates an autoimmune disorder has occurred. Now, autoimmune disorders are when your own antibodies attacks your own body tissue and causes inflammations or swelling. For the respective case of RA, these antibodies are called anti-cyclic citrullinated peptides, anti-CCPs, or anti-citrullinated protein antibodies, ACPAS. Usually, when these two antibodies are present in the body, along with visible physical disorders, it confirms the diagnosis of RA. In seronegative RA, however, blood test for RF is negative. This indicates that the body is not producing any anti-CCPS. However, if the body still presents visible physical deformities like inflammation, joint swelling, and fatigue that are present in RA usually, this confirms the diagnosis of seronegative rheumatoid arthritis. Interesting note, there have also been studies that prove people with seronegative RA can eventually develop seropositive RA as their bodies start developing the antibodies that indicate seropositive RA. Some of you might be wondering, how does RA actually cause physical deformities? Well, due to RA risk factors, they induce a mutation in the collagen 2. This mutation results in replacement of arginine amino acid with citrulline amino acid. The antigen-presenting cell APCs, such as dendritic cells, which patrol our tissue, recognize this new mutated collagen. These antigen-presenting cells have specific detecting molecules on their outer cell members called HLA molecules. Specific types of these HLA molecules become confused and deal with the new collagen as a foreign body. As a result, the antigen-presenting cell phagocyte this mutated collagen. After digesting these citrullinated collagens, the APCs present some parts of the protein on their outer surface as foreign bodies. These foreign bodies are called rheumatoid factors, and they are very common in serum of patients with rheumatoid arthritis. Moving on to joints, the activated phagocytes will release inflammatory cytokines such as TNF-alpha, which causes the inflammatory damage to the joints. They also secrete IL-1, IL-6 cytokines that stimulates synovial membrane proliferation and swelling, which causes this visible swelling on RA patients. Now that I'm done with explaining the mechanisms of RA, I will now pass it to Francis, who will explain the signs and symptoms of RA.